Welcome to this Alberta Health Services training video for safe client handling, repositioning in bed. The information and guidance provided is based on research and best practices available as of January 2015 and is brought to you by the AHS Workplace Health and Safety Department. Boosting a client up in bed. The worker explains the procedure to the client and how they can assist if possible. First, adjust the bed to the comfort zone, raising it to the appropriate height for the tallest worker. Remember to lower the head of the bed so it is flat, or if needed, into a Trendelenburg position, which puts the client's head lower than their feet. Next, lower the side rails of the bed. Runway slider sheet sets are recommended for clients who require frequent repositioning or boosting in bed and have limited or lower function. These are ideal for long-term care clientele. Remember to place the pillow at the head of the bed. Ensure the client's shoulders and hips are on the top sheet of the runway slider set. Use a log roll to reposition the client if they're not properly placed. Please refer to the log roll training video. Instruct the client to lay flat on their back, crossing their arms on their chest and bending their knees. If the client is unable to bend their knees, place a pillow under their lower legs to decrease friction during the move. Workers adopt an upright, neutral, and supportive posture. Grasp the top sheet at the client's shoulder and hip level in a safe, effective grip. By grasping the sheet with the palms upward, hands are close to the client and workers pull a sheet tight. Instruct the client to push with their feet and tuck their chin to their chest. A small rolled up towel or pillow under the neck can be used if the client is unable to tuck their chin. The primary worker counts 1, 2, 3 slide and both workers transfer weight to the foot nearest the head of the bed. The worker's knuckles should not leave the surface of the bed and their elbows should remain tucked to their sides during the move. Repeat this step as many times as necessary to move the client up in bed. The workers will then tuck the top sheet of the runway slider set in after repositioning, or the client will slide. Moving the client side to side in bed. Explain the procedure to the client and how they can assist if possible. Workers will need to adjust the bed to the comfort zone, raising the height to the appropriate level for the tallest worker. The primary worker grasps the top sheet at the client's shoulder and hip level in a safe, effective grip by grasping the sheet with the palms upward and positions himself to use a front-to-back weight transfer. The client's legs should be moved toward the center of the bed in preparation for the move. The secondary worker can assist with open palmed hands placed on the client's shoulders and hips to provide directional guidance only. The primary worker counts 1, 2, 3 slide, and on the command word slide, the primary worker transfers the client while the secondary worker gently guides them. Repositioning using a sling. The positioning sling is ideal for bed management to turn or roll a client from side to side or to move or reposition a client in bed. Refer to the manufacturer's instructions regarding the devices used for repositioning, as there are products available that can remain under the client at all times and can be placed on the bed or surface before the client is in position. If it is not a product that can be left under the client, it must be put in place and removed before and after the move by log rolling the client. Position the base of the lift centrally under the bed. The lift must be positioned so the harness loops can be safely attached without effort. The spreader bar needs to be lowered to attach the sling. Attach all loops on one side of the sling to the bar. Once the sling is attached, raise the lift to begin turning the client. The worker can also raise the bed rail for added support. Once the sling is supporting the client, the secondary worker can apply gentle pressure to both hips and shoulders to complete the reposition. Apply cushions or pillows behind the client's back for added support or comfort. Once the cushions or pillows are applied, the sling can be lowered to allow the client to relax back onto the cushions or pillows. The loops of the sling should be removed from the bar, and the sling should then be straightened. The lift can then be removed from under the bed. Repositioning using a limb support sling. The limb support sling is ideal to support limbs while facilitating the change of dressings on arms, hands, legs, feet, or to elevate and hold limbs during surgery. For example, Placing under the hips may allow a slight elevation of the hips into a slight pelvic bridge position. The band sling can also be applied through the standard log roll application method. It is important the sling be applied as to reduce the risk of skin irritation during the application process. In some cases, due to limb size or technique, it may be advantageous to use 2 band slings. This may require the band slings to be moved during the procedure, but does provide maximal support. Remember, stop, look, and listen. Reduce the risk of injury by asking yourself 3 questions. What can the client do? What equipment do I have available to me to complete this specific task? And how can I get into a good body position for this move or transfer? Now, it is time for you to put the information from this video into practice in your job and workplace.